Montana's Medicaid expansion, primarily funded by the federal government, is set to expire this summer if state lawmakers don't act to extend the program. As Montana PBS's Stan Parker reports, the fight is pitting Montana's healthcare industry against fiscal conservatives in the Senate.
On a cold day in January, a group of Montanans gathered at the Capitol steps to voice their support for continuing Medicaid expansion in Montana. Lawmakers at last renewed the program in 2019, and unless they act again, health care coverage for roughly 75,000 Montanans will expire at the end of June.
Medicaid expansion has worked for Montana. Do we agree to that? Yeah! All right.
Although Medicaid expansion has broad support, Republican leaders in the Senate are concerned about the cost to the federal government.
The United States is moving in an unsustainable pattern with $36.4 trillion of debt. To get that back into balance is extremely difficult, and the longer it goes on, the more difficult it becomes.
Several Montana nonprofits helped organize this rally, including Big Sky 55 Plus, an outfit where Kristen Stewart works as a part-time organizer.
This affects a lot of people in Montana, often working people who are caregivers like myself.
Kristen is part of the demographic that Medicaid expansion mainly provides coverage for: able-bodied adults of working age whose incomes, for whatever reason, fall below a certain threshold. In her case, full-time employment would mean sacrificing time spent as a caregiver.
Initially, when I qualified for Medicaid, I had recently moved back to Billings. I actually left a job that had health care, but there was no flexibility. At the time, my grandfather was still alive, and we had 2 to 3 errands a week in the middle of the day that needed to be driven to.
Medicaid expansion is distinct from standard Medicaid, which covers specific groups like children, adults with disabilities, and expecting mothers. Expansion covers working-age adults who make up to 38% more than the federal poverty level, or FPL. The FPL varies by family size, so, for example, a single parent with 2 kids would be covered by Medicaid expansion if they make up to about $37,000 this year. Here's where Medicaid expansion dovetails with other programs. If that parent made less than 25% of the FPL, they'd be covered by standard Medicaid. If they make more than the FPL, they can get help from the federal government to buy private insurance on the marketplace, up to a point. But between 25% and 100% FPL leaves a coverage gap that Medicaid expansion fills. If you find the difference between standard Medicaid and Medicaid expansion confusing, you're not the only one.
Many emails I get are actually writing in about Medicaid because they're concerned about elderly people, infirmed, mentally ill, or disabled people losing their benefits. And that's all Medicaid. And so no one in the legislature is talking about diminishing benefits for those who have true needs: mentally ill, disabled, infirmed, elderly, pregnant moms, etc.
Even Senator Carl Glimm, who introduced a bill to phase out Medicaid expansion, got it wrong in committee.
So Medicaid expansion is for able-bodied adults without kids.
It's a point we cleared up in our interview.
If you have kids, you would qualify under traditional Medicaid.
But only if you're making less than 25% of the federal poverty level.
I would have to check on that.
We took a few minutes to get on the same page and confirm that yes, the Medicaid expansion sunset does affect many Montanans with children at home.
Yeah. Yep. You're right. 25%, under 25%. So 24%.
5 days after that interview, Glimm's proposal stalled when it failed to pass a floor vote. This could be a sign that the Senate will look favorably upon a House bill to lift the sunset and keep Medicaid expansion in place. That bill recently passed its final vote in the House and is now in the Senate's hands. That bill was introduced by Republican Ed Buttrey of Great Falls, who also carried the Medicaid expansion bills in past sessions.
We did something really special for the people of Montana in 2015 and again in 2019. We created a system that, unlike in other states, actually moves people out of poverty and onto the road of success. Our system puts health care back in the doctor's offices and out of the emergency rooms. Our system has enhanced the pool of workers available to our businesses. And I'm happy to say we have ensured the future of our rural healthcare systems. All of this while providing a positive savings to our general fund and the taxpayers of Montana.
A steady parade of voices from Montana's healthcare industry, tribal nations, and business community showed up to support the bill.
You're improving the quality of services available to Montanans that otherwise might not be able to afford health insurance.
The ability for me to hire behavioral health providers alone, this is just for behavioral health, has greatly improved the mental health of our reservation. I'm not sure where we would be without Medicaid expansion.
I'd be concerned that the loss of this program would threaten the future of Northern Montana Hospital and many other critical access hospitals across the state.
Among those supporting permanent expansion of Medicaid was Billings Clinic CEO Clint Seeger, who says when people don't have insurance, they sometimes put off care until they end up in the emergency room.
Delayed care is always more expensive, and I worry about patients having to receive their care largely through the emergency room because they don't have access to basic health care, and so things get delayed until it's critical.
The healthcare community, speaking as a united front, is not persuasive to Senate Republican leadership, including Majority Leader Tom McGilvery of Billings.
There's one person that never shows up at hearings. The person that's working 40, 60, 80 hours a week and paying taxes.
Despite data showing expansion having a positive impact for Montana's economy, he worries about the federal budget. Medicaid expansion spending in the state was about $1 billion in 2023, and the federal government pays 90% of that. For standard Medicaid, the feds pay around 62%.
Every country in the history of the world that's ever failed because of debt problems, Germany, Rome, ancient Israel, etc., Argentina, they inflate. But for the big risk is for our grandchildren, my grandchildren, your children, because when you are broke as a nation, when you are financially weak as a nation, you are susceptible to foreign adversaries who want to take advantage of you. So it's our grandchildren and our children that have to fight wars for the freedoms and the liberties and the financial ability to sustain ourselves that we squander. That's what's at stake.
And Senator Glimm argues there's a risk in leaning so heavily on the federal government.
It's crazy for us to think that the status quo is going to be the same, because the low-hanging fruit for real dollar change in the federal budget comes into some of these programs, and Medicaid expansion is a huge one. I think we're better off if we get those people working into a working job. We've got tons of employers looking for help. You can't go anywhere without seeing help wanted signs in the state of Montana. And if we put those people to work, it's better for everybody.
Stats from the Department of Labor show the majority of Medicaid expansion enrollees are already in the workforce, and many of those that aren't have health issues, have a caregiving role in the family, or are going to school. And Buttrey argues Montana's expansion program has shown itself to be a temporary measure for many people as they get back on their feet.
The average time for an individual in the program, notwithstanding the public health emergency, is 22 months. This is a fact, and it completely debunks the myth that once somebody gets on this program, they never leave. Furthermore, independent data clearly shows that when our economy is good, our enrollment numbers drop. And this is how we design the program: to get people healthy, get them jobs or better jobs, and to be less reliant on social services, and to a place where they can rely less on state and federal programs, and they can rely more on themselves.
Data also show that Medicaid expansion has done a lot to bring down the number of uninsured Montanans. Jamie Hernandez, a resource navigator at Riverstone Health in Billings, says she worries the uninsured rate will rise without renewing expansion. And although the healthcare marketplace will be an option for some, she says it's not always a good one.
Lower income families that really fall within these expanded categories I don't feel like the marketplace is going to be a good best next option for them. And I say that because from helping people with enrollment with that, there are a lot of options on the marketplace. However, they can be really specific to what medical facility you attend, and that can kind of lock you into some services. And then they have, a lot of the plans have really, really high deductibles on them as well. And so even if maybe someone would find a cost plan that they felt like they could afford, they may not be able to utilize it because they may never meet the deductible of the plan.
For folks like Kristen Stewart and her grandmother Frances, the flexibility provided by Medicaid expansion is a big help.
I don't know how we would have gotten around without her. She's just been a godsend for me. She's been a lot of help, and I don't know what I would have done without her.
I don't know everybody's situation. Everybody's situation is different. So it's not like we're not without compassion here. But again, you have to deal with the problem of scarcity in this country. Do you want to destroy everybody's livelihood because you're moving programs that are simply unaffordable? Or do you want to make choices?
For Dr. Seeger at Billings Clinic, he doesn't dismiss the fiscal policy concerns.
I wouldn't say that those are not concerns that should be addressed, and that's outside of my pay grade to address some of those big questions. But I think whatever system or however we do this, what's important is to make sure that patients have and people have access to care, and we can deliver high quality care in no matter where you live.
For Impact, I'm Stan Parker.
Montana is one of 40 states with a Medicaid expansion, along with the District of Columbia. The 2010 Affordable Care Act originally mandated the program nationwide, but the U.S. Supreme Court ruled that lawmakers in each state should decide whether to expand eligibility.